My name's Dr. Bill Virtue, and I practice in Yadkinville, North Carolina, and I've been practicing for 34 years. I first became aware of the dangers of mercury filling from a colleague of mine in Winston-Salem, and decided to attend a meeting in Durham with the IOMT. That was my first experience, and rather shocked at what I learned that weekend. I was most shocked because what I had been doing and practicing and what I'd been taught in dental school wound up not to be the thing to do. It was difficult to kind of wrestle with the concept that I had been doing the wrong things, putting mercury in people's mouth and using fluoride. So for someone who's been trained and practicing for a number of years, you tend to believe what your dental school taught you. And we also tended to believe what the ADA told us. So if you're protecting the patient the ultimate amount you can, you're also protecting your staff member and yourself from the dangers of mercury. Making a patient comfortable, not only physically comfortable, but emotionally comfortable so they know they're in the right place. A lot of people who come into a biological dentist have been to a lot of different dentists, that they haven't heard the right thing. We know that if we have a patient who's generally very, very educated about biological dentistry, because these people, they're on the web, they're out in the internet, they learn a lot about what should be done. And one of the things we teach in the fundamentals is that if you don't do all the right things, that patient will know it in a heartbeat. So they have to be comfortable emotionally knowing that you're the right person to do the job for them. Understand that you have to get the mercury out of the mouth before you can get it out of the body. So once we remove it from the mouth, and even subsequent visits, each visit, the patient might go directly back to the physician, alternative physician, I point, that so that the physician can chelate that patient with various, it might be vitamin C or DMSA or whatever, because we're trying to make sure it stays out of the body and get it out of the body. So it's a combination of working with us and working with physicians. But patients often come back and tell us how much better they feel, or how much better they chew, how much better they feel. There's two aspects of dentistry. You have the people who want to do just cosmetic dentistry, and people want to be prettier. We all want to be prettier. But the beauty of biological dentistry is even the back teeth are going to be prettier because they're going to be the same color as the tooth rather than have the black fillings. It's a shame to put a set of veneers on a pretty lady, and when she smiles, she's still showing black teeth in the back. So what we do by removing those in a proper, safe way allows that patient to be even more beautiful, and we feel even healthier. And if nothing else, understand mercury fillings crack teeth. Now we have imaging, we have cameras that we show the patients, we have the TV monitors, and we explain all the cracks in the teeth. I have never taken a mercury filling out of a tooth that doesn't have a crack in it. Now eventually, that crack is going to break. People come in all the time and say, I was eating mashed potatoes and my tooth broke. Well, the truth is a tooth was broken before, but it came apart when they were eating something. So by showing the patient with this mercury filling, don't understand too, mercury fillings expand 9 times more and contract 9 times more with hot and cold. The tooth doesn't. 9 times more than the tooth, I should say. So by cycling hot and cold, these fillings expand and eventually crack the tooth. Plus, over the lifetime of that mercury filling, it constantly expands. That's just the nature of the material. So eventually, every mercury filling is going to crack the tooth to some degree. Maybe not catastrophic, but it's certainly going to crack it. And what we find, 6-year molars on the lower jaw are the most commonly crowned tooth because that's the first one to get filled with a mercury filling. So as that mercury filling gets replaced with a bigger one and a bigger one, eventually the tooth breaks, either requiring a root canal or certainly requiring a crown. So with biologic dentistry, what we're doing is we're going to find that incipient, we call it lesion, or that little tiny cavity. We're going to, a lot of times in children particularly, we're going to clean that out without even numbing it many times and put a bonded filling in that tooth. That may be the last time that tooth worked on. So that's one of the many advantages of biological dentistry. I would like a new patient that's coming to our practice to go to our website, because that's an opportunity for them to really look and browse through all the information to get a feeling of what the dangers of mercury, and particularly fluoride, are, and at the same time have the confidence to know that I have the experience to do it properly.